A warm welcome to Health and Lifestyle and a very happy new year 2026. As we step into this fresh chapter, it's the perfect time to prioritize our health and well-being. Now today, we are diving into a topic that affects many of us, at least unknowingly, and that is vitamin D deficiency. But first, a look at what's coming up. Vitamin D deficiency and why it's more common than we think. Understanding the deeper health implications of low vitamin D levels, tips and good practices to help you boost your vitamin D levels. All that in the good practice. And to our first segment now. Have you ever woken up feeling exhausted despite a full night's sleep? If so, you're not alone. Many people experience persistent fatigue, and the culprit might be something as simple as vitamin D deficiency. Now, vitamin D is crucial for overall health, playing a very key role in bone strength, immune function, and even our mood. But despite its importance, many people don't get enough of it, mainly due to factors such as poor dietary habits. And surprise, surprise, lack of sun exposure. Even though the sun is a natural source of vitamin D, many Kenyans are missing out on this essential nutrient. Urban living means we spend more time indoors, at work, or in traffic, or even behind screens. And children are no longer playing outside like they used to do. Now, common symptoms of vitamin D deficiency include fatigue, muscle weakness, and even mood changes like depression. In Kenya, where sunlight is even abundant, it might seem surprising that vitamin D deficiency is still common. Well, stay tuned because after this break, we'll be speaking to an expert to help us unpack the complexities of vitamin D and guide us on how to boost our levels effectively. Stay with us. Thank you for staying with us. Even in a sun-drenched country like Kenya, many people still struggle with low vitamin D. What are the hidden health complications of low vitamin D? Well, Dr. Nicola Cage is an endocrinologist. She sheds light on this surprising health concern that often goes unnoticed. Let's listen in. Why there is an increase in vitamin D deficiency. Are you seeing that in your practice, and why is this happening?
Yeah, so we see a lot of vitamin D deficiency. The thing is with vitamin D deficiency, the symptoms are most of the time very vague. You can't pinpoint and say this is actual vitamin D deficiency unless you go to a healthcare practitioner who has had experience and who has what we call a high index of suspicion that this could be a vitamin or specifically a vitamin D deficiency. So I would not necessarily say that there is an increase. It's just that we're probably picking it up more because now as doctors, as clinical practitioners, we're a bit more aware that there's this thing called vitamin D deficiency.
So, yeah, we can just continue. You're talking about the fact that it's not that it is increasing, but now it's being picked up, or people are becoming aware of it.
We are diagnosing it more just because we are testing it more. Okay. So what I was trying to say is that sometimes you find that in people who are a bit of darker skin, we tend to have higher rates of vitamin D deficiency if you compare to like Asians or Caucasians. And the reason for this is because it's more difficult for the ultraviolet rays from the sun to penetrate the melanin in our skin. So because we have more melanin as Africans and dark-skinned people, then we tend to have a higher rate of vitamin D deficiency when you compare people who are white, Caucasians, or Asians for that matter. Yeah.
It's not really a matter of it increasing, but maybe the awareness, like you're saying, people are becoming more aware, and there are better ways of diagnosing also, you know, and all that. So, you know, you've mentioned about darker skin, more melanin for that matter. Let me not say darker skin, but melanin. But we'll be catching up on that later on talking about who is at risk. Because it's interesting to say that people with melanin are likely to have, a deficiency in vitamin D, but most of these people actually live where the sun is all around the whole year and all that. So it's interesting how you have a lot of sunlight, but you can still suffer vitamin D deficiency. But we'll be getting to that when we talk about the risk factors for it. But now let's talk about the health implications, But before we even delve into the health implications, just the symptoms first of all. How does somebody detect? How can somebody know that there could be an issue with my vitamin D deficiency?
Depends. For the presentation is different when you compare adults and children. For children, obviously, looking more at their milestones. So like for a young child, you'll see this child's delayed walking, they're not able to sit up straight. And then when it comes now to the very extreme, they get this condition that we refer to as rickets. Most of the time, it could actually be without symptoms. What we say is non-specific, non-symptomatic. So what happens is that sometimes we'll just pick it up as maybe a person has come for a wellness checkup and then the doctor says, okay, let's check your vitamin D. Other than that, the symptoms are not very specific, what we say non-specific symptoms, but most people will complain of feeling fatigued, lack of energy, maybe they have issues with their appetite and things like that. On the very extreme, some people will tend to present with bone aches and pains of their muscles and their joints. And that's when now you would suspect issues related to vitamin D deficiency.
Like you said, they're very non-specific, and so you can mistake them for anything else. If you have body aches, chances are, oh, this could be malaria. Maybe I traveled the other day. Let me take some malarial, tablets. Or I've been overworking. You're fatigued, from work. Let me take a rest, and then it continues like that. Now, the danger is it can also have health implications if it is not, resolved very fast. So let's delve into the health implications of, deficiency in vitamin D, and this cuts across, from immunity to more or less most of your bodily function.
Yeah. So, you're basically right in that vitamin D deficiency does have some health implications. Mainly when anyone talks about vitamin D, we are always thinking about, okay, it's related to bones, it's related to calcium, but we know its effects extend well beyond bone health. So it's also involved in the integrity of your breathing system, your heart, and even how your brain develops. So what we generally tend to see most often is issues related to the muscles and the skeletal system. So most of the time it will interfere with the integrity or how your bone structure is formed, because vitamin D is important in the absorption of calcium from your diet. So if you don't have enough vitamin D, then that means that even if you take enough calcium in your diet, it's not being absorbed from your gut. So you don't get that calcium going into your bone and forming that mineral that makes your bones strong. Okay. In addition to that, it's also involved in immunity and fighting infection. So you find those who are in vitamin D tend to have a higher risk of getting infections, particularly when we talk about respiratory or lung infections. So most of these people will tend to have a higher risk of infections, particularly when you look at the respiratory system. Some time back during the COVID time, there was also an association between low vitamin D and worse or more severe COVID infection. We found that as much as, yes, we found that the people who had low vitamin D also had very severe forms of COVID-19 infection, there was no benefit to adding vitamin D treatment for these patients. It did not confer any protection these patients when it came to the severity of the illness. Now, when we look at vitamin D deficiency, particularly when you look at expectant ladies, vitamin D is important in development of the developing baby, the fetus. And particularly when you're looking at the brain development, the development of the lungs, and the development of the heart. We find that ladies who have low vitamin D during pregnancy will tend to have children who have underdeveloped lungs. So if a child has underdeveloped lung, then it means that they grow into they have issues with breathing as they grow older. Such children also present with difficulties in learning, developmental difficulties, because it also interferes with the way the brain has developed. So it's important that ladies, even as much as they conceive, they also have their vitamin D levels checked during pregnancy, and the obstetricians also emphasize and supplement these vitamin D levels whenever they are low.
Let's just delve a little bit deeper, if possible, with the heart connection, your cardiovascular health. And I think when I was trying to research, I also saw diabetes can also be linked to maybe vitamin D deficiency. Maybe you can clarify.
So there's a small link between vitamin D deficiency and blood sugar control, because vitamin D has been found to help with insulin sensitivity. So when there is reduced levels of vitamin D, we find that patients tend to have a lot of insulin resistance, and insulin resistance is obviously directly linked to diabetes. Okay, so there is that small link between diabetes, development of diabetes or severity of diabetes, and vitamin D deficiency. Then, of course, when you now extend diabetes in and of itself will obviously, at some point, if it's not well controlled, affect the cardiovascular health.
Okay, and I just want to stick there a little bit more, because can I say, I'll give an example. Probably when I was having all this fatigue, and I'm thinking like, maybe it's just stress, but other than that, it was like, oh, maybe I'm not eating enough. So you tend to eat a lot. And obviously, you know what happens when you start eating a lot, you gain the weight, and all that. But I know it's more complicated than what I'm saying, in the sense of deficiency in vitamin D vis-a-vis your fat cells. I don't know whether you're getting where I'm going as the expert, because vitamin D, can I say, I don't know that this is the correct way to put it, like it helps to, can I unlock fats from your cells or something? There's something about vitamin D and the fat cells, something of that sort.
So when you think about vitamin D and the way it affects appetite, basically you talk about how it affects appetite. So vitamin D generally tends to affect the hunger and the appetite signals. And this mainly occurs as a result of hormones that are released either from the level of the brain or the level of the fat itself. So these hormones that generally affect appetite fluctuate when there is low vitamin D levels. So the fat generally produces a particular hormone called leptin, which is important in suppressing appetite. And the stomach generally produces a hormone that enhances the appetite. So when there's an imbalance between the suppressing appetite and the appetite stimulating hormone, then that tends to increase the appetite as a result of vitamin D deficiency. And then you see that someone tends to get more hunger pangs. So it's mainly a hormonal alteration in the balance between appetite stimulating and appetite suppressing hormones.
And then let's talk about the at risk, people who are at risk, the groups that are at risk, most of us, or at least a good number of us, are working in offices. Some of us come very early, as early as before the sun is up, and you leave when the sun is already set.
So those who are at risk of vitamin D deficiency are people with a darker skin or higher melanin, as I've mentioned. Those people who have a problem with absorption of nutrients from the gut. So there are people who have what we call malabsorptive syndromes, okay? Like a condition called celiac disease that tends to interfere with absorption. So as much as, yes, it's interfering with other nutrients, it also interferes with vitamin D absorption from the gut. In addition to that, the elderly are at an increased risk of vitamin D deficiency, and also those who have had, who are less exposed to the sun. Just as you mentioned, for us in our population, as much as we live in the tropics, most of us will leave our homes well before the sun is up and get back to our homes after the sun has gone down. And most of that time in between, we have spent it in the office and not really gone out to what we call sun bask. So as much as we are living in the tropics, we are in a position that we can be able to be at higher risk for vitamin D deficiency. So those are just majority of the people who have an increased risk of vitamin D deficiency. In addition to that, people who have excess weight, if your BMI is more than 30, then you are considered to have a higher risk of vitamin D deficiency in addition to other nutrient deficiencies.
Someone will ask, like, why are people with a darker skin or more melanin, will have a problem with vitamin D absorption?
The reason is because what happens is that the best source of vitamin D, natural vitamin D, is that you get when you expose yourself to the sun. Okay, so as much as, yes, nowadays there are vitamin D supplements we get them over the counter, our doctors prescribe. The amount of vitamin D that you get from exposure from the sun is almost 10 times higher than you'll be able to get from a supplement of vitamin D. Now, what happens is that the rays that enhance formation of vitamin D are ultraviolet B rays. So these ultraviolet B rays do not penetrate melanated skin as well as they penetrate non-melanated skin as much. So people with darker skin or more melanin have less likely chance of the ultraviolet B rays getting into the skin and being able to form vitamin D. In addition to that, as much as, yes, our dermatologists will always tell us, when you're in the sun, please make sure you wear sunscreen. There's also the downside of wearing sunscreen, because if you wear sunscreen, then it means you're preventing that ultraviolet B from penetrating the skin.
Vitamin D deficiency can definitely be tackled by just sun exposure. But then again, we have this thing that the dermatologists tell us that we have to wear sunscreen and avoid the sun by all means, because it's going to damage your skin. But it has its downside to it, So how can we then, change? How can we improve vitamin D, intake?
There are certain foods that tend to have a higher amount of vitamin D when they are ingested. And then that's now what we would encourage. If you want your patient to get vitamin D naturally, then you'd encourage them to take in these foods. So these tend to include fatty fishes like salmon, sardines. Okay, I mean, these things are a bit exotic for us, but foods which have fish which are fatty, or codfish, things like that. In addition to that, mushrooms also have high amounts of vitamin D. Certain kinds of cheeses also have high amounts of vitamin D. And then, of course, bone broth. We always talk about bone broth, but it also has a high amount of vitamin D. So we encourage our patients to take these and increase their intake of vitamin D. When all else fails, there is always the artificial or drug or supplementation of vitamin D, which you can have done. Some prescriptions are available over the counter, but you always have to be aware that some of these over-the-counter prescriptions of vitamin D don't contain as much vitamin D as they say on the label. So it's always good to get a credible source of vitamin D, either by a prescription from your healthcare provider. Yeah.
Exactly, because you can supplement if your vitamin D levels are low, but just taking care that whatever supplements you're taking actually are effective. Otherwise, the best way is just your diet. Eggs, egg yolks, I think also a very, very good vitamin D, source. There is liver, and I think red meat, if I'm not wrong, because I think those are some of that are readily available. Can I say, even in our setting, we talk about exotic foods, but in our settings, you have the eggs, and especially the egg yolks. But remember, we're also being told avoid egg yolks because it has a lot of fats. But everything is in moderation at the end of the day, Yeah. So thank you so much, Dr. Nicola Okage, for joining us and just helping us understand, vitamin D deficiency and how that works and everything. But maybe before I go, let me not, before we close, how does somebody, what entails deficiency? Let me put it that way. So what entails deficiency? So you're supposed to be taking all these dietary, intakes which have vitamin D, but what constitutes a deficiency of vitamin D?
So usually the way we check for vitamin D is that we just check for the levels of your active vitamin D levels in your blood. So usually if you just go to a lab and request for vitamin D, they'll usually know they are doing vitamin D3 levels. So the sufficient amount of vitamin D that an adult should have is anything above 30 nanograms per milliliter. Usually we say 30 to 100. That's where we consider it adequate, because we know that anything above 30 will enhance calcium absorption from your gut once you take it via diet. If you're deficient, you could either be insufficient or completely deficient. So insufficient is anything less than 30, so from 29 up to around 12. That is what we would consider moderate or in levels of vitamin D. And then completely deficient, less than 12. Funny enough, we see a lot of very low levels of vitamin D. People come with levels of around 15, 16, 17 levels around there. But usually at that point, then you would probably recommend they get an injection of a very high dose of vitamin D. And then after that, they continue with a weekly supplementation of vitamin D.
What's your pattern shot? It looks like a very, how do I put it? Like, it's not like it's serious until it gets serious, Like, yeah, it's just vitamin D. It's just a vitamin. It's like I'm lacking proteins, or we put a lot of emphasis on carbohydrates and all these things, but then we don't really look at the vitamins, the smaller, nutrients, if I may put it that way. So what's your pattern shot?
Yeah. So as much as, yes, we always focus on what we call the macronutrients, that is the protein, the fat, the vitamin, the carbohydrates, it's important also to look at your micronutrients. And this is now where your vitamin levels fall. And seeing that vitamin D is very important in various processes, particularly when you're looking at your bone health. And as you grow older, you know that we tend to lose more bone as we grow older. So it's important that you have your levels of vitamin D screened. As much as, yes, we live in Kenya, we live in the tropics, there's a lot of sun. Remember that the vitamin D deficiency are still high in our population. So we need to have ourselves screened. Although there is currently no benefit to population-based screening, those who are at risk, as we've mentioned earlier in the episode, should have their levels screened. Pregnant ladies, it's important to check what your levels of vitamin D are. And also for infants, it's important to check, particularly when you see that the milestones are a bit delayed when it comes to movement, sitting, walking. Always have your child checked for levels of vitamin D.
Thank you, Dr. Nicola Okech. Well, that was Dr. Nicola Okech just talking about the health concerns of low vitamin D levels, from risks of, diabetes and heart diseases, to the unique challenge, I guess you didn't know this, faced by people with darker skin in absorbing vitamin D. Remember, simple lifestyle changes, diet and regular checkups can make a big difference. So on Good Practice today, we summarize some of the common symptoms of vitamin D deficiency and how simple steps like just spending a little time in the sun each day can make a big difference. Low vitamin D can show up in ways we often ignore. That includes feeling constantly tired, experiencing muscle weakness or body aches, mood changes like feeling low, sad, or depressed. Now, in children, severe deficiency can cause rickets, affecting bone growth. The good news is that vitamin D deficiency can be prevented and managed. Start with your diet. Eat vitamin D-rich foods like salmon fish, egg yolks, liver, mushroom, and meat to support your daily needs. The sun is one of the best natural sources of vitamin D. So spending short periods outdoors helps your body make vitamin D naturally. While sunscreen protects your skin from UV rays or skin cancer, it can reduce vitamin D absorption. Balance, therefore, is key. People with melanin-rich or darker skin absorb vitamin D more slowly. This means longer or more frequent sun exposure may be needed to maintain healthy vitamin D levels. Sometimes food and sunlight may not be enough, so consider supplements, but always consult a healthcare professional first. And there you have it. Remember to soak in some sunshine. It's the most inexpensive way to stay healthy. And do consult with your doctor in case you have any of the symptoms that have been mentioned. Thank you for joining us. My name is Marie Yambo. Remember, small changes can lead to big impacts. So stay healthy and eat healthy. We'll see you next time on Health and Lifestyle.